Okay, so we're at Runnymede Medical Practice, and this is Jennifer Webster, who's been training with us as a physician's associate at Reading University and coming to the practice on a Friday. Jen, do you want to just explain to us what a physician's associate is?
Sure. So a physician associate is a new healthcare role that's been made within the NHS in order to work as part of a multidisciplinary team in order to support doctors, support nurses, and help form diagnoses and create management plans for patients. It's sort of enabling a sort of new continuity of care, which is really important for patients who use the service a lot.
Great. And what kind of settings do physician's associates work in?
So physician associates can work in general practice, such as here, or we can work in hospitals. We can also work in clinics. So I also work in an ambulatory clinic at the Royal Berkshire Hospital as well. So we're really diverse. I mean, we've got a general skill set which allows us to sort of fit into lots of different specialities actually.
Tell us about your training and what you're doing currently.
So to become a physician associate, you have to have a degree in a health science related course already. So I did biomedicine, and that's quite a common course to come from. And then this is a 2-year postgraduate course that sort of is a very intensive clinical practice course, as it were. So we cover anatomy and physiology, we learn how to diagnose, treat and manage sort of acute conditions and chronic conditions as well. And in addition to lectures, we also work in placements pretty much from day one. So we work in general practice to start with, and that's starting off with shadowing doctors, sitting in on consultations, and then eventually we start to have our own consultations. So I've been seeing patients by myself at the moment, and then after I'm done seeing the patient and asking them some questions, examining them, I then case present. So I present the patient to my supervising doctor, and then we all discuss the next step in management.
And just tell me how the patients in the practice have received kind of the care that you've been giving them.
I think they've received it really well actually. I love meeting new people, and so many of the people that I've met have been so happy to sit and chat and talk about their experience so far. And I've really enjoyed teaching people about what a physician associate is. So there's been a lot of confusion. Some people think we're doctors. We aren't doctors. We're separate from doctors, but in terms of what a physician associate can do that maybe a doctor can't, is that we can spend more time with you. And I think that's quite valuable, and I think patients really appreciate that as well. And that's come across in a lot of my consultations, that patients really appreciate having more time to sit down and talk about the sort of their general symptoms as well as the sort of something that's brought them in.
And just tell me from a practice perspective, how kind of your training so far, how you fitted in with the rest of the practice team?
Really well actually. Everyone here has been really, really welcoming. I've really enjoyed it, and I know my colleague Zane, who's another physician associate, has really enjoyed it as well. We've been made to feel very welcome from staff and patients alike, so thank you very much.
Great. Thanks very much, Jen.
No problem.